Riverside Healthcare puts the health and wellness information you need well within reach.
Welcome back to the Well Within Reach podcast. I'm your host, Helen Dandurand, and today I'm going to be joined by Wendy Holman, RMG Operations Director, to talk about Riverside's footprint and outlying clinics.
Healthcare can be confusing, but thanks to your My Riverside MyChart, you can easily manage not only your care, but your family's as well. With a single click, your My Riverside MyChart lets you stay well connected to the same information your provider sees. You can view your health history, get test results, request prescription refills, pay your bill, or make an appointment. Manage your care from anywhere, your laptop, phone, or tablet. Learn more and enroll today at riversidemychart.org.
And we're back with Wendy. Thanks for joining me today.
Thank you for having me.
Of course. So this is your first time on the podcast. Could you tell us a little bit about yourself and about your background?
Yes, absolutely. I've been with Riverside for 2.5 years, and I currently serve as the Operations Director for Riverside Medical Group. In this role, I oversee operations at the diagnostic centers and a few of our outlying clinics. My background is rooted in healthcare management and patient-centered operations with a focus on improving access, supporting providers, and enhancing the patient experience.
That's awesome. How did you find yourself in that role?
Well, I started out with University of Chicago. It was then Ingalls Memorial Hospital, and I was working in their lab for many, many years, and I was approached to become a clerical supervisor for one of the clinics. And then from there, I just worked myself on up, and I joined Riverside back in 2023.
That's great. That's amazing. All the things that you can learn from all the different kind of places that you start and you go from. So that's awesome. So you have a lot of experience and there's a lot to talk about today. So there are a lot of different things that come to mind when someone says Riverside. For many, their minds go to our main hospital. But can you explain more broadly about the outpatient services Riverside offers and how they are such a large part of what Riverside is?
Yes, that's a great point, actually. While Riverside Medical Center is certainly a cornerstone of the organization, our outpatient services play a vital role in caring for the community. But what many may not realize is that Riverside's outpatient services make up a significant portion of the care that we do provide. Across our network, we offer a wide range of outpatient services from primary care and specialty clinics to diagnostic imaging, lab services, physical therapy, behavioral health, and same-day care options. These services are available at convenient locations throughout the region, helping patients stay on top of their health without needing to go to the hospital for routine or preventative care. It's really where we build the lasting relationships and support patients in managing their health every day outside of the hospital setting.
Yeah, I think it's important, and people are realizing more now than ever before that your health is constantly happening. It's not just when something big happens and you need to go to the hospital. So caring for yourself and having that self-care routine in going to those visits is so important. And a big part of that, and you mentioned primary care. How many different Riverside Medical Group primary care locations are there?
Yeah, we have over a dozen Riverside Medical Group primary care locations throughout the region and in 4 different counties. These range from rural health clinics to larger multi-specialty campuses. Each site is designed to bring high quality, accessible care closer to home for our patients. Whether someone is new to the area or seeking preventative care or managing a chronic condition, they can find trusted providers within their community.
That's great. So Riverside has some of these other full campuses in outlying areas. We've got Coal City, Frankfort, and Watseka. Can you tell us a little bit about the services offered? Let's start with the Watseka campus.
Yeah, absolutely. I actually started my career here at Riverside at our Watseka location, actually. I think Watseka is a great example of how Riverside brings comprehensive care to the more rural communities. Our Watseka campus offers a wide range of services. We provide comprehensive primary care with providers who see patients of all ages for everything from routine checkups to chronic condition management. In addition, we offer walk-in immediate care services 7 days a week for those unexpected illnesses or minor injuries. The campus also includes on-site lab and imaging services. We're proud to offer specialty services as well, including oncology, neurology, cardiac services, wound care, sleep evaluations, and physical therapy.
That is such a wide array of services, and it's awesome that folks can just get all of them at one place so they don't have to be running all around
Mhm.
town and trying to figure out where they need to go. We've got it all in one place there. How does the Coal City campus kind of differ from what is offered at Watsika? And I know there have been some recent exciting changes there as well.
Yes, absolutely. The Coal City campus has recently expanded, nearly doubling in size to better meet the needs of the community. With this growth, we've added more exam rooms, we've expanded our provider team with the addition of Dr. Ferris, and introduced new services like oncology and infusion and physical therapy. Just like Watsika, we also offer immediate care clinics 7 days a week. We also have extended clinic hours Monday through Friday. So it just makes it easier for every patient to get the care that they need.
Great. And last but not least, could you tell a little more about the Frankfurt campus and their services?
Yes, the Frankfurt campus offers a wide range of services as well, including primary care, specialty clinics, and advanced diagnostics, all in one convenient location. Patients have access to specialties like cardiology, oncology, and orthopedics, along with on site lab and imaging. It's a great resource for the community, providing comprehensive care for everyone.
We are going to take a quick break to talk about primary care at Riverside. Consistency is being able to count on someone to be there when you need them. At Riverside Healthcare, your primary care provider is dedicated to being in your corner, helping you and your family stay healthy and thrive. Find the right primary care provider for you at myrhc.net/accepting new. From annual screenings to well checks and everything in between, having a primary care provider that you can trust makes all the difference. And we are back. So, Wendy, can you touch a little bit on the benefit of having these campus locations where multiple specialties are all housed under one roof?
Sure. Having multiple specialties at a single location is a major advantage for patients. It reduces the need to travel to multiple locations. It simplifies coordination between providers, and it often shortens the time between referral and appointments. It's also more convenient for patients managing complex or chronic conditions who may need to see more than one provider in the same day. It's all about making healthcare easier to navigate and more accessible.
That's great. And yeah, and not only is it just like, oh, convenient to not have to travel and things of that nature, but when you are within one organization like the Riverside Medical Group, all of your things are in one place. Within my chart, you can see your records, your providers, they already have a rapport and communicate often and well. So I think that's really helpful. Could you maybe elaborate on that a little bit?
Sure, my chart plays a key role in enhancing the patient experience. With one login, the patients can view their test results, they can message their care team, they can manage appointments, and even complete forms ahead of their visits. On the provider side, having a shared electronic medical record allows our teams to collaborate more effectively and ensure continuity of care. It really creates a more unified and informed experience for everyone involved.
Yeah, my chart is really so wonderful. And I didn't really have to live in a time without the my chart in my adult life. But I just can't imagine not being able to see, the things that you're able to see now without having to call or have them send something to you.
Mhm.
It's really just a great, great tool that we have. How does the Riverside Medical Group ensure that the quality care and patient experience is consistent across all of these different locations?
Consistency comes from strong leadership, clear expectations, and ongoing support. Within RMG, we focus on standardized workflows, training, and regular communication between all the sites. We monitor key quality and patient experience metrics, and we use that data to drive improvements. We also encourage feedback from staff and patients alike, which helps us respond quickly to any concerns that may arise and continue raising the bar.
Well, looking ahead, are there any plans or goals you can share for expanding Riverside's reach or enhancing services at these outlying locations?
Yes, we're always looking for ways to evolve with the needs of the communities that we serve. That may include recruiting new providers, expanding service lines, or even investing in infrastructure that improves access and experience. We're also focused on enhancing our use of technology, both in the clinic and through digital platforms, to offer more flexible options like telehealth and remote monitoring. Ultimately, our goal is to meet people where they are and continue delivering the highest level of care close to their home.
That is wonderful. Well, thank you for joining us.
Absolutely. Thank you for having me.
And thank you, listeners, for tuning in to the Well Within Reach podcast brought to you by Riverside Healthcare. For more information, visit riversidehealthcare.org.